Hey folks, Dr. Joe Esposito here. I am so happy that you're with us today. And if you've listened to the show before, you know I've been in practice a long time. I've been in practice 38 years. And patients come to me all the time, and some of the patients are what I call a taint nothing patient. And what I mean by that is they have a symptom, and they say, oh, doc, that taint nothing, don't worry about it. I'm here for my back, I'm here for my headaches, I'm here for my sciatica, whatever it is. But when we do our history, we find out these other things going on, and they ain't taint nothing somethings. There's something that needs to be addressed right away. There's serious problems. So a lot of you may not realize that you have an issue that can be a serious problem. You just think, it's no big deal. Everybody has it. I've had it since I was a kid. We're going to go over some of those today. Most of them I'm going to go over today specifically for men. And the reason is men are traditionally not very good at taking care of their health. And many times the problem gets so bad that it's harder to fix or maybe not fixable at all. And so we're going to talk about that today. If you have any healthcare questions, go to my website, drjoe.com, drjoe.com, and anytime, if you have a healthcare question, a little bot pops up and says, hey, want to chat? And you can send questions, and me and my staff will try to get back to you as quickly as we can. We want to be your doctors. We want to help you get well and stay well. Sometimes the answer is very easy. Sometimes it's, take a supplement, cut out this food, change your diet, whatever it is. Sometimes it's a little more complicated, but I'll let you know. If you should come see us, if you go see another doctor, if you could simply take a supplement, we'll try to lay all that out for you when you send your questions. But right now, I want to talk about these problems that men have that many times they just totally ignore. And then it becomes a real serious issue. And just yesterday, I had a patient, and they came in, and they had neck pain and back pain, classic chiropractic stuff, digestive issues that we work on anyway. And then they put in the bottom swollen ankles. And it was an African-American woman, middle-aged, slightly overweight. And she said, I've always had swollen ankles. It's not that big a deal. It tain't nothing. So I said, let's look at this. So I did a little further evaluation, and she's a very high risk of cardiovascular disease. And the swollen ankles are a sign that there's a problem with circulation. So I said, we need to sit down. We need to change your diet. We need to get you on some supplements that maybe helps increase the circulation. One of them I recommended was nitric oxide. Nitric oxide is my third favorite supplement, in case it's ever a trivia question. It's my third favorite supplement, and it helps increase circulation. So we sat down, I did a nutrition evaluation, and then she said to me, she said, Dr. Joe, I know I have swollen ankles, and I know you told me to change my diet and cut out the animal products and the salt and things like that. But then she said, but Dr. Joe, the holidays are coming, and all my favorite foods are on the holidays. And I said, let me ask you a question. If it's truly your favorite food, why don't you eat turkey in July? Why don't you eat pumpkin pie in August? You only eat it once a year. If it truly was your favorite food, you'd eat it more often. She goes, never thought of it like that before. And I said, you can do whatever you want. I can only give you advice. So whether you listen to me or not is totally up to you. But if I had swollen ankles and I was high risk and I knew I had a risk of cardiovascular issues, I think it's worth giving up that 5 minutes of eating turkey. And she looked at me and she said, yeah, I get it. So you have to think about, is it worth it? That's a question I ask myself every meal that I have. Is it worth it? And if the answer is yes, eat it. If the answer is no, don't eat it. It really is just that simple. So you're going to look at something and say, wow, is it really worth having this margarita with dinner tonight? Well, I always get a headache if I drink, and I know it's a lot of sugar, and it puts on weight for me, and alcohol destroys brain cells, and the artificial sweeteners and the coloring they use can affect my brain function. Is it worth it? Probably not. Once you understand health, you'll get that it's not worth it. I saw a Facebook post this morning. Kid I grew up next door to, okay? We lived at 408. He lived at 400, whatever it was. And a year younger than me, grew up with him, played sports with him and everything. He's dead, dropped dead. And he always had health issues, and he smoked, and he drank. I'd see posts on Facebook over the years. So Ken died. And I thought to myself, was it worth it for him to keep smoking? Was it worth it for him to go out drinking with his friends? Maybe it was. But I can't imagine anything more important than your health. You know, there's election season, there's politics going on, there's war, there's famines, there's inflation, gas prices, a lot of stress going on. The one thing you have control over is your health. And I don't want you to ignore these problems because many of them are easily fixed and inexpensively fixed. You just have to know how to get them fixed. So, if you have swollen feet or ankles, don't take it lightly. It could be due to eating too much salty food, but it also could be a sign of heart failure, kidney disease, liver failure, circulatory issues. That can become a big issue. And so just be careful with that. And a lot of people say, well, Dr. Joe, I like my bad foods, whatever those bad foods are. Okay. Think about it. And then it was funny. I was at an event last weekend. I was up in New Jersey with my extended family, and somebody's husband was there. So I didn't know who he was. So he starts talking, and they offered me some cheese. I said, no, I don't eat cheese. I don't eat meat. And he said, oh, you're vegetarian? I said, well, I'm vegan. I've been vegan for a long time. And I goes, yeah, I eat meat sometimes, but not often. He says, and he said the question, everybody says, where do you get your protein? I said, oh, God, here we go. Your body only needs about 8 to 10% of its total caloric intake as protein. Anything beyond that is wasted and actually puts stress on the body. And I was talking to Jacqueline, somebody I just recently met, who has a master's in nutrition, and we talked about kidney failure and how often people have kidney failure. And we're seeing it's like an epidemic. And one of the big problems is too much protein. Because the protein, when it gets into your kidneys, irritates the kidneys and can cause damage to the kidneys. So if you think you need more protein, the answer is no, you probably need less. Most people need less protein. Even if you're plant-based, like me. I've been plant-based now. I've been vegan for 35 years. Even if you're plant-based, you're still getting more than the recommended amount of protein if you're eating a good variety of foods. So think about that. You don't need more, you need less. And too much protein can affect the kidneys, and that can cause swelling of the ankles, and that could be a warning sign. So don't ignore swelling of the ankles for men or women. If you get shortness of breath, and now, yeah, I understand you go for a run, you get shortness of breath, but you expect it to do that if you're moving furniture, running upstairs, things like that. But if you're just walking from the kitchen to the bathroom and you start getting shortness of breath, that can be a sign of something called COPD, chronic obstructive pulmonary disease. Or it could be something like bronchitis. It could be pneumonia. It could be asthma. So if you're winded very easily, that's not a symptom you want to ignore. Well, doc, I'm just out of shape. I'm getting old. I get that. But is it really getting up from here to the bathroom? You can't breathe? That's a serious sign. When I was in high school, I remember I came home one night, and my father was sitting at the kitchen table, and he was gasping for air, and he was turning yellow. Freaked me out, needless to say. So we quickly called the ambulance, and we rushed him to the emergency room, and his lungs had filled with fluid. His heart was failing, and he wasn't able to pump and circulate blood, which allowed fluid to build up in his lungs. And the doctor said, had we not gotten him to the hospital when we did, probably another hour he'd be dead. So it was scary. I physically carried my father out to the ambulance, and I thought, wow, he was always out of breath, but I just thought, hey, he's getting old. He's got a big beer belly. It was no big deal. He didn't drink beer, but he had a big gut. No big deal. Could have died because I was young and I didn't realize we shouldn't ignore those symptoms. And so they pumped the fluid out of his lungs. It turns out he had a bad heart. He had a weak valve in his heart. They needed to do surgery on him, and they did, and he lived many years afterwards. And so that's a miracle of medicine. Wonderful job they did. But had we known that his being out of breath was such a serious issue, we could have done something about it. Again, I didn't know what to do about it. I was probably 15 years old at the time. So if you have these symptoms, you don't want to ignore them. Now, if you have symptoms and you're not sure, because it could just be that you're out of shape. If you're not sure and you want to set up an evaluation with me and my team of doctors, we'd love to see you. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. And if you want to make an appointment, just go to our website, drjoe.com, drjoe.com, and make an appointment. So whatever your health issues are, neck pain, back pain, shoulder pain, headaches, numbness, tingling, we're talking about some symptoms today. It may be a chiropractic case. It may be something we have to refer you out for. If it's something we need to refer you out for, we usually co-manage the case. We work it with the other doctors. And so we can work together to try to get you the best results possible. And doctors, I love co-managing cases with other doctors because nobody has all the answers in healthcare. I don't. Hospitals don't. Emergency rooms don't. Nobody has all the answers in healthcare, and that's why I like to look at my offices as the captain of your ship. Come to us, and we're going to steer you in the right direction. We're going to say what direction to go in. So we're going to captain your healthcare issues. And many people don't have that. They go to one specialist, and they say, well, I don't know what it is, so take this pill. Well, just because a doctor doesn't know what it is doesn't mean it can't be diagnosed. It means it can't be diagnosed by that doctor. And it's unfortunate. I see this in medicine all the time where people get very narrow-minded. Well, I don't know what it is, and, I don't know much about nutrition. I don't know much about chiropractic. I don't know much about acupuncture, massage, physical therapy. So if I can't fix it, it can't be fixed. It's a shame because a lot of people suffer and die because the doctor's arrogance. So it's a good idea to get an evaluation, and we'd love to be your doctors. To book the appointment, normally the first visit is $940. That's an exam, x-rays, consultation, first adjustment, going over the x-rays, complete nutrition evaluation. Those prices just went up, by the way, because we just looked at the national averages, and our prices were too low. I haven't raised the initial cost that I charge my listeners. It's still $299. We've reduced that from $940 to $299. So if you're serious about wanting to get well, book it right now, drjoe.com. My doctors fill up very quickly. My doctors are very good at what they do. And so they fill up quickly. So if you want to reserve that time, you might want to do that right away. We accept people with all insurances. It depends what your coverage is, but we accept you. It depends what the coverage is or not, and we'll verify that for you. And if you're ever in a car accident, please, folks, if the car's damaged, you're damaged. I've never seen it any other way. So please come see us as quickly as you possibly can because the insurance company's going to play games with you if you're in a car accident. Well, you didn't go to doctor, so you weren't hurt. We're going to deny your claim. I hear it every day. Well, I didn't have a car because my car got smacked up. Yeah, we don't care. So let us help manage and be the captain of your auto accident cases. Don't fall to scams. People call you up and say, well, you're in an accident, Joe, and you go see this doctor and this lawyer. That's a scam. They're called runners. They get paid a lot of money by doctors and lawyers to get your name off the internet and call you. It's always a scam. Don't fall for it. Anyway, I digress. So we're talking about symptoms you don't want to ignore. Trouble breathing is a big issue. Now, a lot of people are just full of mucus. If you eat things like wheat and dairy products, that can cause a lot of mucus to build up in your lungs, and that can prevent you from getting oxygen into the body. But if you have sudden shortness of breath, that should raise concerns. Gosh, normally I walk up the stairs, there's no big deal. Today I took 2 steps, I'm gasping for air. It can be caused by a clot in your body, and sometimes you have clots in your leg, blood clots, and they travel into the lungs, and they cut off the lung supply. It's called a pulmonary embolus. Massive pulmonary emboli, I guess, can be fatal, but a quick diagnosis and treatment can be life-saving. Long plane rides can do that. You get off the plane because of barometric pressure changes, and you suddenly can't walk through the airport. You're gasping for air. Your legs might hurt. Get yourself to an emergency room. Don't jerk around. Better to be safe than to be sorry. A friend of mine, recently, my friend Tim, he took some aspirin. He had a headache. Took some aspirin, and his tongue swelled up. Didn't know he had an allergic reaction to aspirin. And it got so bad that he was smart enough to get his fanny over to the hospital. They brought him to a doc in the box. The doc in the box said, nothing we can do for you. You got to get to the emergency room. They had to call an ambulance. The ambulance drove him to the hospital. Hospital, he said, was like a Three Stooges movie. Nobody knew what they were doing, stumbling over each other. Finally, they gave him a shot of epinephrine. The swelling went down. And I said, Tim, that was very smart of you. Very smart to get to the emergency room. So if your tongue keeps swelling and you can't breathe, you then can't get yourself to the emergency room. So he realized that he had now has an allergic reaction to aspirin. And so he's being very careful. He won't take aspirin anymore, of course. But you don't know it until you know it. I had a professor one time in college. He said, it's never a problem until it's a problem. And then it's a problem. And so, yeah, a lot of things you don't know are happening. And that's why this show exists. I try to give you information so that you can make better decisions about your health care and hopefully avoid it becoming a problem. And that's why if you go to our website, drjoe.com, we have over 3,000 hours of podcasts. So all you have to do is type whatever you're looking for in the search bar, whatever topic it is. Chances are we've done a show on it. And so you might want to tune in, listen to it. And if you want to become a patient, you can book it right through the website. If you have questions, you can send them to me through the website, drjoe.com, drjoe.com. Happy to answer your questions for you. If you have severe pain when exercising, stop. When I played football, when I played hockey when I was younger, I remember, you got to muscle through the pain, got to muscle through the pain. To a point, that's true. But if you can't bend over, or you can't, lift something because the pain is so severe, don't muscle through it. Because I see this a lot with athletes, and I treat a lot of professional athletes as well as amateur athletes. If you have bones out of place, pinching nerves causing pain, and you keep working out, you build up strong muscles around crooked bones. I want you building up strong muscles around straight bones. Just that simple. So that's why so many athletes, professional and amateur, have chiropractors, because they realign everything so that when they exercise, they don't cause more damage. And I've had a lot of athletes muscle through the pain, and then years later come see me, and the joints are all worn out, the discs are worn out, muscles are torn. And they say, well, doc, I didn't realize it. The trainer said just keep working through it. Not a good idea. And that's why, 30, 40 years ago when I first started this whole fun ride, people didn't refer to chiropractors. And now we get referred to constantly. Professional athletes, trainers, medical doctors, orthopedists, neurologists, neurosurgeons, hospitals are referring patients to us all the time because they realize that they're limited in the progress that they can make. And now I can't fix everything either, but it's nice to co-manage the case. So if you're having pain like that, many times it's a pinched nerve. And here comes a logical question, rhetorical question. If it hurts when I'm pinching the nerve, what should we do about it? Unpinch the nerve. Make sense? So you want to get those bones back in place. 206 bones in the body, any one of them can come out of place. Could be your toe, could be your ankle, your knee, your hip, your shoulder, your skull. Skull bones can come out of place. I trained with a doctor named Dr. Bertrand Desjarnais, the founder, the developer really, of cranial adjusting, of adjusting the skull. Now, I was 18 when I studied with him, and he was already in his 80s, so he's not with us anymore. But just such a genius, such a brilliant man, such a pleasure to be in his presence. One of my coaches. I want to be your coach, folks. I want to coach you through health. So if you have health issues, in fact, we're even setting up a Facebook group now. And if you want some information on that, just send me a message through the website, put coaching in there. I'll have somebody send you some information. But we're setting up a weekly Facebook page where I'm going to coach people through their health problems. Because so many of you over the years have said, Dr. Joe, I need your advice, but I can't come see you. I live in Australia. I live in England, wherever it is. I can't come see you, so I need some coaching. And so we've set up this Facebook coaching group. So just send me a thing called coaching. Just say coaching. I'll get you information on that. Other issues you don't want to ignore. We're talking today about symptoms you don't want to ignore. If you get full really easily during a meal, what may be happening is your stomach, which is supposed to sit below your diaphragm, might be pushing up into the diaphragm. And if the stomach pushes up into the diaphragm, you many times can't breathe. I had a patient the other day, and he says, Doc, I was told my diaphragm is too high up in my body. And I said, what did the therapist say to do about it? He goes, I don't know. She just said I had my diaphragm too high up in my body. I said, well, we got to look at the nerve supply to the diaphragm because maybe it's a pinched nerve not allowing the diaphragm to work properly. And the diaphragm nerve comes out of your neck. It's the fourth cervical nerve called the phrenic nerve. And when I checked him, sure enough, he had a pinched nerve there. And then I checked to see if his stomach was pushing his diaphragm up, and it was. So if we can pull the stomach down away from the diaphragm, and we can check the nerve supply to the diaphragm, that's a very novel approach to healthcare, isn't it? Because there's no exercise in the world you can do to fix that. There's no drug in the world you can take to fix that. You need to open up the nerve supply and physically move the stomach. So if you feel very full very quickly, it could be that your stomach is slammed up against your diaphragm. And the stomach just doesn't have, it's all spasmed out. Now you might also have acid reflux, heartburn, burping, gas, bloating. Those are all signs that the stomach is probably pushed up into the diaphragm. And the only treatment I know of, and I've been studying this now for 40 years, is to physically pull the stomach down away from the diaphragm. How cool is that? A lot of you listening right now had an aha moment. You went, aha, I have heartburn, acid reflux, diarrhea, constipation, bloating, gas, bad breath. I wonder if my stomach is up against my diaphragm. Chances are yes. And we'd love to see you for that because my doctors are really good at fixing that stuff. And the reason I know they're really good is because I have that condition. And when my stomach is pushed up against my diaphragm, sometimes I feel so full, but I want to keep eating. I'll have burping and bad breath. And I know right away it's time to get one of my doctors to pull my stomach away from the diaphragm. So I taught all of them how to treat me. So I know they're doing it right. And so that's why so many patients come to us literally from all over the world with not just neck pain and back pain and shoulder pain, but with digestive issues, constipation, diarrhea, bloating, gas. All those things are something you don't want to ignore because it's telling you you're not digesting your food properly. Those are all symptoms. Bad breath. I was at a party the other day with one of my friends, and her breath was just awful. And she knows me, and she's patient. And I said, hey, listen, I need to go adjust your stomach. Your breath stinks. So we went into another room, and I actually did it standing up, which is kind of weird. But instantly, her breath got fresher. She goes, test it now. Oh, it's better. Good. Okay. So she knew. She wasn't offended when I said she had bad breath. She knew that her stomach was in the wrong place. And the food was essentially sitting in her stomach rotten. Pulled the stomach back down, everything got better. So many times you have healthcare problems that are physical, not chemical. And we think chemical, we think of medications and drugs. And yeah, sometimes they're absolutely necessary. But many times you're not treating the cause, you're treating the symptom, which is fine. If I have a headache, I'll take some acetaminophen to get rid of my headache. But then I want to find out, why did I have the headache? More important. And then I'll come in, I'll get one of my doctors to evaluate you. Oh, sure enough, your neck is out of place. Your stomach was out of place. I had an injury to my ankle one time, years ago, on my knee. And so sometimes I have to adjust my knee or my ankle because it's causing my body to torque or twist, and that's putting stress on the spine, which was causing a headache. So my team of doctors really good detectives. We can dig deep and try to find out what's wrong and then try to treat this cause and not just treat the symptoms. So when you have the symptoms, and that's what we're talking about today, if you have these symptoms, it could be a sign of something very serious. And you don't want to ignore it. And the longer you have something, the harder it is to fix. And that's a serious issue. So again, if you have any questions, go to our website, drjoe.com, drjoe.com. Book an appointment to come see us. The best thing to do is let us evaluate you and let's see what's going on. Every day, been doing this for a long time now, every day patients come to me and say, Dr. Joe, why didn't I do this sooner? Why did I wait so long to address these serious issues? And my answer is always, I don't know. I don't know. You have the information. You know where our offices are. You have access to us. What are you waiting for? Life is way too short to live in pain, to have malfunctioning bodies, and to have things that can't be fixed because you waited too long. It's very disheartening for me to tell a patient, you know what? You've got so much arthritis in your spine. The muscles have changed their structure, and I can get you some relief, but I'm not sure I can actually get to the cause. And then we teach every patient nutrition, things that you can do every single day at home to manage your own health. My goal is to have you take control of most of your own health, give you the tools that you need to do to get yourself well. And so we teach nutrition, we teach you exercises, we teach you how to stock and unstock your pantry, how to go out to restaurants. If you have any questions, send them to me through the website again, drjoe.com. Hey, do me a favor. I'm not done yet. We got lots more to cover. Follow us on social media. My handle is at Dr. Joe Esposito. We post every single day. There's no reason why you shouldn't be following us at Dr. Joe Esposito. And if you're a podcast junkie, go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it, all separate words. And you'll see our podcast there. And we have hundreds of hours of podcasts available to you 24 hours a day. The website, search it for any symptoms you might have. Just search in the search bar. Supplements, we're going to talk about supplements coming up, what supplements I recommend everybody should be on. And again, the website, drjoe.com. I'm Dr. Joe Esposito. Tell your friends about the show. We'll be right back. Hey, folks, Dr. Joe Esposito here. Thanks for hanging around if you're hanging around. Thanks for joining us if you're just joining us. What we're talking about today are symptoms that you shouldn't ignore. Now, I've been in practice a long time, and patients come to me all the time, and they say, well, doc, I come for you for neck pain or back pain or headaches or car accidents or sports injuries, whatever it is. And then I take a thorough history on them, and they'll kind of give a throwaway thought. Oh, by the way, doc, the other day I had trouble speaking. I couldn't form words, but it went away. No big deal. No, that's a serious issue. That can be a sign of a stroke or worse, brain tumor. So they said, yeah, but it went away. I said, I understand that, but why did you have trouble speaking? You're X amount of years old. You've never had trouble speaking before. Why are you having trouble now? And so I go down another rabbit hole with this patient. And that's one of the things that I love about my doctors is they're such good interrogators. And they dig deeper than anybody else. I remember one time I cut my mouth, and I went to the emergency room. And by the time I got to the emergency room, I got checked in and sat there and waited, and the doctor came in. It was a Sunday afternoon. He looked at it, he said, "Stop bleeding?" I said, "Yeah." He said, "You want a tetanus shot?" I said, "No." He said, "Okay. If it gets infected, come back." And he walked out of the room. Literally, that was the whole engagement I had with the doctor. And I thought, wow, there could have been other things going on with me that he didn't know about. What if I cut myself and, I don't know, I bled out or something like that? I lost too much blood. He never checked my eyes. He never checked my hearing. He never checked my speech pattern. Basically, my answer was no. Didn't watch me walk. And so I thought, wow, this could have been a really serious issue. And he just glanced over it and went on to the next patient. That was it. And I got a bill for a level 4 exam. They didn't do a level 4 exam in the hospital, and it was a whole nother story. I had to call them up and tell them they're billing wrong. And so anyway, hopefully we changed that to hospital's practices because they were way overcharging everyone. But I digress. We look for things, and again, we're not perfect. We're not going to find everything. Nobody's ever going to find anything. That's not reasonable to find everything. But if you're unable to speak, you know something is off. Sudden onset difficulty speaking could be, as we said, a stroke. And the quicker we diagnose something like a stroke and get you for medical care, the better off you're going to be. Less chance of disability and less chance of death. So if you ever find yourself in a situation where you can't speak, you need to get that checked right away. Get yourself to usually emergency room is the first place, and they'll probably have a neurologist look at you then. But find that out, because again, that's not a chiropractic case in many cases. That's a medical case. But that's okay. I'm here to help you and get you to the right doctor for the right treatment. Same theme. If you feel weak on one side of your body, suddenly you can't move your arm, can't lift your arm, you're dragging your leg around, that's immediate medical attention. That could also be the sign of a stroke. So be careful with that. If you have skin discoloration, darkening of your skin could be a sign of what's called Addison's disease. That's a disorder that occurs when the adrenal glands aren't producing enough cortisol. Now, if you've listened to my shows I've done on hormone balancing, too much cortisol can be bad. Not enough cortisol is also bad. Okay, so if it's low cortisol, that's an issue. Symptoms develop slowly over time, so you might have extreme fatigue, weight loss, decreased appetite, and then you start having these huge spots of this. Usually the whole skin actually becomes discolored. You might want to get yourself checked right away, and we'll do a blood test on you and find out what that is. Now, this is going to sound like a silly one, but it can be a serious issue. If you have mood swings, that can be a sign that something is very wrong. Now, yeah, we all get in moods sometimes. We get angry. Sometimes it might be a hormonal cycle for men and women, and that could create mood swings. But if you notice that your friends are telling you something that seems off, they're acting irrationally, they're responding too much to something, to a stimulus or something that shouldn't be that big a deal, monitor that. It may not be one or two times that you see it. If it's something that happens on a regular basis, there could be something wrong. So what we do in our office, we can test the hormones. And we do a test called the Dutch test, the UTCH. And what a Dutch test is you urinate. We collect urine samples throughout the day. Well, you collect them. I don't collect them. And we send it off to the lab, and we monitor your urine to see what kind of hormones your body's producing, but more importantly, how your body's breaking them down and excreting them. Because your body takes raw materials, nutrients, builds up these things called hormones. Hormones do their job. They're broken down and they're excreted. So they have a life cycle. So if your hormones are off, it can have some very serious impact on your moods, on your health. And so it's not just these crazy mood swings. It's a symptom that something's wrong. We've probably all met people in our lives say, oh, boy, he's crazy, she's nuts, she's a psycho. Yeah, I understand that, but many times that's a sign that there's something not right. I remember I had a patient one time, and she was just, Shakespeare called it mercurial. If you ever saw mercury, mercury is a liquid, and you can't pin it down. It rolls around, and you try to catch it. We were kids, used to play with it. Now it's toxic. It was toxic then, too. But Shakespeare would call somebody mercurial, meaning they were hard to pin down. Their personality was very volatile. That's a sign that there's something wrong. And this patient came in, and one day she was happy, and one day she was sad, and one day she was crazy, and one day she was yelling, and one day she was, introverted. And I said, something's not right here. So as I dug deeper, she didn't tell me all this on the first visit, it turns out she's got horrible digestion. Burping, gas, bloating, diarrhea, constipation. And when I got close enough to her, I realized she had really bad breath too. And now I realized that her stomach was not breaking down proteins properly. Now your stomach has essentially one job. And that job is to take proteins, whether it's from a steak or a carrot or a piece of lettuce, unravel it, because protein looks like a ball of yarn under a microscope, chop it up into something called amino acids. Now the amino acid named tryptophan becomes serotonin in your brain. Serotonin is a mood stabilizer, helps you focus, makes you happy. Serotonin becomes melatonin, which helps you sleep. And so if you're not breaking down your proteins into amino acids, amino acid tryptophan becomes serotonin, and you need vitamin B6 for that too. And serotonin becomes melatonin, you may not be sleeping, you may not be very happy, and you may have attention deficit disorder, mood instability. And so once I realized all this, I said, okay, let's look at her stomach. And sure enough, her stomach was pushed up against her diaphragm. So we pulled it back down away from the diaphragm. And when I discussed it with her, she goes, well, I didn't want to talk about the fact I'm really gassy and people tell me I have bad breath because I was embarrassed. Well, if you don't give us the information, we can't analyze you. And so we did that. We got her on some supplements. And again, the minimum supplements I think everybody should take are Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. And I take a scoop of each, and I mix it with some coconut milk or almond milk, and I kind of shake it up. So this morning I had a frozen banana with it. And I have that first thing in the morning every day. Somebody asked a question the other day about chlorella and spirulina. What is that? Well, it's sea vegetables, basically. It's algae. And it's a great source of omega-3 fatty acids, and also helps break down waste products in your liver and clean up your liver. So I can't imagine why everyone listening right now is not at least taking Super Greens and Essential Source. And they have digestive enzymes in them that help break down your food. And so I got her on that. I also put her on special digestive enzymes as well to help break down the proteins more efficiently. And within about a week or two, everything changed in her. She became a totally normal, quote, person. And I love when patients come to me and they're crying, because it's usually good tears. And I remember she said, Dr. Joe, you saved my life and you saved my marriage. I'd been a psychiatrist, psychologist. I've been to doctors. Nobody could figure out why I was so moody. I didn't know why I was so moody. And it turned out that she wasn't digesting her food properly. Now, also, it could be a sign of a pancreatic issue, because your pancreas also produces digestive enzymes. And if you're not breaking down your food because the pancreas isn't working, that can be a very serious issue, including something as bad as pancreatic cancer. And so mood swings are not something to be taken lightly. So if you realize that you're not stable, you're mercurial, you might want to get that checked. And we can do a Dutch test, check your hormones, we can check your digestive system, and let's try to get to the cause of the problem. Again, everybody's moody every now and then. Right? REM song, everybody hurts sometimes. Everybody's moody sometimes. But when it becomes systemic, like your whole body, your whole life, that's when it's something that we have to take a look at. Don't ignore that symptom. And if you know somebody who has that symptom, sometimes it's hard to say to them, hey, you know what? You're awfully moody. I think you need to go see Dr. Joe and his team. You could say, hey, listen, I was listening to Dr. Joe the other day, and he was talking about how the nervous system controls everything, and everybody should get their spine checked. Why don't we go together and let's get an evaluation? And then the onus comes on me or my staff to discuss what we just discussed. It's not something easy to talk about with someone. Hey, listen, man, something's wrong here. Because if they're moody, many times they don't want to hear it either. So it's a sign that there's something wrong. And that's why balancing the hormones, balancing the digestive system, and getting the body working really is the key to getting them healthy. Not just unmoody, but actually healthy. And of course, mood swings to extremes can be dangerous and even deadly. So don't ignore that. Don't say, tain't nothing. It is something. Tain't nothing means it's not nothing. Okay, that's a southern term there, taint. So if you feel consistently thirsty, we're talking about today symptoms you don't want to ignore. If you're thirsty all the time, and even though you're drinking a ton of water, you're just not quenching your thirst, it could be a sign that you have diabetes. Now, I've been in practice a long time. 35, 38 years ago, whatever it was, I didn't see a lot of cases of diabetes. I didn't see a lot of cases of kidney failure. I saw a few cases of high blood pressure. Now I'm surprised when somebody doesn't have diabetes or high blood pressure or kidney issues. I'll say, wow, if you're over 30 or 40, chances are you're on some type of medication and you're a wreck. And no one in my career, I've seen thousands, I'm going to guess tens of thousands of patients, no one has ever come to me and said, Dr. Joe, my doctors want to get to the cause of my problem. They want to find out why I have diabetes. They want to find out why I have high blood pressure. No one has ever said that to me. And I wish they would, because that would change the paradigm of healthcare. I don't know if the healthcare system is ready for that kind of change. You are. I know you are. You wouldn't be listening right now. But if the healthcare system isn't ready, that's okay. You and I can do this alone. And now I'm not saying stop taking your medication. I'm not saying stop your blood work and everything. Let's work to get you well. So if you have neck pain, back pain, shoulder pain, numbness, tingling, headache, sciatica, muscle weakness, the conditions we just talked about, why don't you come see us? In fact, I'm not going to say why don't you. You need to come see us. Stop suffering needlessly. So if you want to make an appointment, you can go right to our website, drjoe.com, drjoe.com, real easy. And all over. Want to make an appointment? Want to make an appointment? It's all over the website. Click on one of those. You can make an appointment or just call us. You can call us 844-44-DR-JOE, 844-44-DRJOE, and make an appointment to come see us. And let's do an evaluation. Let's find out why you're not as healthy as you could be and what we can do to get you to that point. Is that exciting? Raise your hand if that's exciting. If you're driving, don't do that. Okay, no. But I really want to get you well and keep you well. My mission, gosh, started many, many years ago, decades ago, is I want to help as many people as I can. And that's why I work as hard as I do. People say, why don't you just retire, Dr. Joe? You're done. Not done, man. I'm just starting. I've got way too much information I need to share with the world. And I've had too many people have too many health crises, literally on a daily basis. And I told the story the other day. I was walking through a medical building, big medical building. I don't know, 6, 8, 10 stories, whatever it was. And as I'm looking at the registry of all the different clinics, I thought, wow, if I worked on all their patients, I'd put them out of business. If I worked on their patients, I'd put them out of business. And probably about 80% of the clinics, I thought, wow, we can help almost all their patients. Maybe not solve all their problems, but help all their patients. One of them I looked in, it was a huge reception area. It was as big as my whole office, just reception area. And it was an allergy clinic. And I thought, I wonder if anybody in this allergy clinic ever was told by one of the treating doctors that you should avoid wheat and dairy products to see if that helps your allergies. I don't know. I've never been a patient there. But I can't imagine they've ever been told that, because most people with allergies, if they cut out wheat and dairy, see improvement. May not solve the problem, but it helps. Then we work on your digestive system. So they start breaking down their proteins more efficiently, because an allergy is a foreign protein, the immune system attacking a foreign protein. And so if we can get their digestive system working and get them off wheat and dairy, a lot of people with allergies go away. Not all of them, but a lot of them. Certainly gets better in most cases. So anyway, if you want to make an appointment, drjoe.com. Normally the first visit is $940. Yes, the prices went up because we just got the national statistics and healthcare prices have gone up. So exam, x-rays, consultation, first treatment, going over the x-rays on your follow-up visit, and a complete nutrition evaluation. For my listeners and everyone you refer, it's $299 instead of $940. So we accept, after that, we accept everybody with insurance. It depends what your insurance covers, but we'll accept you. I'd say about 40-50% of our patients are cash-paying patients anyway, because their deductibles are stupid high, $6,000, $5,000. Copays are often more than what we charge per visit anyway. And so it's extremely affordable. We even have care credit, so you can put your payments on payments up to 18 months with no interest. That's a third party we use. But we do everything we can to get you under care. And all we ask is that you show up and do what we say. It's a pretty simple request, isn't it? Do what we say. And I always say that. I'll say if you're a patient, I'll say this too. Do what I say for 60 days. If I'm wrong, I'm wrong. So what? I'm wrong. I lied to you. But if I'm right, which I am in most cases, then you'll say, okay, Dr. Joe, now I get it. I understand this is what I need to do. So once you experience that health, you don't want to go backwards. And if you do, you cheat, you slip up or something like that, you go, wow, I don't like this. I don't like the way I feel. I want to keep doing this. So much more fun to be healthy than it is to be sick. So drjoe.com, we'd love to be your doctors. And if you're ever in a car accident, if the car's damaged, you're damaged. I've never seen it any other way. And I teach other doctors and physical therapists and lawyers how to deal with car accidents. They get credit for their license renewal coming to my seminars. So I'm pretty good at car accidents. My team of doctors are. And we can document it for you. We can help you find a lawyer if you need to, somebody who's not going to screw you over, because I see that happen a lot. So if you want to make an appointment, drjoe.com. We'd love that opportunity to work with you. All right, we're talking about symptoms you shouldn't ignore. We kind of brushed on bad breath earlier. Now, I'm Italian. I like garlic. So if I eat garlic, I'll get some bad breath. No big deal. But there's two types of bad breath. One of them is, boy, you just ate garlic, or maybe you went to the dentist and you have a rotten tooth. The other one is when it smells like potty. It smells like a toilet. That means you're not digesting your food properly. And so in your colon, these foods are rotten, and they're giving off gases. And these gases get absorbed into your blood system, which then go into your lungs and exchanges in your lungs, and you get this rotten potty breath. That's a sign that you're not digesting your food properly. And if that's the case, many times we just have to fix your digestive system, not your mouth. Because you can swish with mouthwash and brush your teeth. It's not coming from your mouth, it's coming from your gut. Don't ignore that. If you have a child, and that child has bad breath, potty breath, get him in to see us right away. The quicker we fix things on somebody's life, the easier it is. The younger they are, the easier it is to fix in most cases. So don't think bad breath is just something that's unpleasant. It's actually telling you that there's something wrong. And you're not breaking down your proteins in many cases, and proteins break down to amino acids. Amino acids become neurotransmitters, and neurotransmitters are the chemicals in your brain, make your brain work. And so if your gut isn't working, your brain ain't working. It's just that simple. Not as well as it should. And that's the same thing with irregular bowels. If you have diarrhea, constipation, those are signs that there's something wrong. And if you ignore it, it's not usually a good thing. Now, if you have unexplained weight loss, that can be an issue. Maybe you suddenly have diarrhea for several days. That's a problem. Because in your colon, you have something called good bacteria, microbiome. And a microbiome is good bacteria, bad bacteria, funguses, yeast, and they all live there happy ever after until they don't. And if there's an imbalance in that and you have diarrhea on a regular basis, you're flushing out a lot of your good nutrients as well as your bad nutrients, and that could be a sign that there's an issue. If you have sudden weight loss and you don't know why, you want to get to your medical doctor right away. It could be cancer. And we don't like cancer. So we got to work on that. We got to keep your body as healthy as we can to reduce your risk of many diseases. I don't have a cure for any disease. I have tons of things to help reduce your risk. Heart disease, diabetes, cancer, obesity, brain function. We talk about those all the time. And in many cases, you can manage those things. And that's why I want to be your coach. I want to coach you through these things. So if you have diarrhea, constipation, these are signs that there's something wrong. Now, if you have a bad diet, chances are you'll get constipation. Your diet should be all fiber, which would be fruits, vegetables, nuts, and seeds. Meat has no fiber. Dairy has no fiber. White breads many times have very little fiber. And you eat a lot of white breads, cookies, cakes, donuts, pastas. And fiber is the thing that pushes everything through your colon. So if you're not eating enough fiber, it's just not pushing through your colon properly. But many times with constipation or diarrhea, it's also a physical problem. You can have a pinched nerve. The nerves in the low back control your colon, sex organs, and bladder. So if you have a pinched nerve, this goes for babies too, by the way, you can adjust that area and open up the nerve supply. So you might have back pain, leg pain, hip pain. Those same nerves control the colon, sex organs, and bladder. Erectile dysfunction, urinary issues, painful periods, irregular periods. Check the nerves in the low back. I don't know why that's not standard operating procedure, because in many, many, many cases, that's the problem. And the other stuff is just symptoms. It's okay to treat symptoms, but you want to get to the cause. We have a supplement on our website, drjoe.com, called Intestinal Formula, and it's great for unclogging the bowels. It's amazing. I formulated that out in California, and it's amazing how well it works. Now, that's the only supplement I'll ever give you that I don't want you to take forever. All the other ones, the super greens, the essential source, the B complex, the adrenal support, the digestive enzymes, the omega-3 fatty acids, what else we got in there? The probiotics. Those I want you to take on a regular basis. Intestinal formula, I want to get your bowels moving, but I want to find out why they're not moving. Now, there are some cases where you have something called gastroparesis, where the bowels just aren't moving. The nerves aren't working properly. And in a case like that, then you want to take intestinal formula on a regular basis. But other than that, I want to get to the cause of your problem and get you off it. But many times just taking super greens and essential source solves digestive problems because there's so much digestive nutrients in it. So I've had a lot of people say, Doc, I always had digestive issues. I take super greens and essential source every morning or afternoon, whenever you want to take it. Amazing results. So the minimum supplements you should be taking are Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. I take a scoop of each. I mix it with coconut milk, almond milk. You could use water, but it doesn't taste as good. Shake it up and drink it. I can't imagine why you're not taking that every day. It's a zillion, is that a word? It's a lot cheaper than a fancy cup of coffee that you're buying every day. It's a lot cheaper than going out to lunch every day. I always pack my lunch anyway. And if you go to our website, drjoe.com, and just type in, so what can I eat? And that's a lecture I did a while ago. It tells you how to change your diet. Breakfast, lunches, dinner, snacks, packing and unpacking your pantry, raising kids, parties, all there. And by the way, the 3,000 hours of podcasts we have on our website, absolutely free. That's my gift to you. Because I want you to get well. And I got to give you the information to do it. I want you to follow us on social media at Dr. Joe Esposito because we post every single day. I want you to sign up for our newsletter. I keep forgetting to tell you guys. About 2/3 of the way down on the home page of the website, it says sign up for our newsletter. Send us your email address. We send out so much cool information on the newsletter. It's free. And unsubscribe at any time. You don't like it, drop us. I'm not concerned that you're going to drop us. You're going to get so much information. You're going to say, Dr. Joe, why didn't I sign up for this sooner? So sign up for the newsletter. We have a lot of good information. I am starting a coaching class online because so many people want advice, and I just can't be giving it on an individual basis like I have been. A lot of you send me questions. If you send me questions, I try to limit it to 1 or 2 questions. If you start sending me a ton of questions, I'm just not going to answer them because I just don't have time. You can imagine, we have the #1 health show in the country on radio. We have 4 offices. I have the supplements and the coaching that I do. I just don't have time to keep answering questions like that. And I'm happy to do it, but I just don't have time to do it. So you might want to join our coaching class. So if you want to join our coaching class on Facebook, and we have a bigger class too, it's called Health Accelerator, just send me the word coaching through the website, drjoe.com, and I'll have somebody send you some information on that. If you're a podcast junkie, go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. And you can listen to all our podcasts on your podcast service. Again, that's no charge either. Social media, we said Dr. Joe at Dr. Joe Esposito. If you are a VA member and the Veterans Administration sends you to us, the VA usually pays for your care, 100%. So you can always ask your doctors at the VA to send you to us. Most people around the country know who we are. And a lot of times they say, oh, yeah, sure, just go see Joe. That's fine. Because the VA doesn't really want your pain patients. They want to deal with other stuff. Pain is one of the tough things to deal with. Anyway, folks, I'm out of time. Drjoe, drjoe.com. I'm Dr. Joe Esposito. Catch you next time.